Hello, everyone. This is Sanskriti here, and today I'm going to be doing a very special session. I'm here to introduce you to Dr. Shefali. She has 22 years of experience in the field of obstetrics and gynecology. She is not only trained in UK and Delhi, but also has a working experience as a senior consultant in Rainbow Hospital, Sarjapur, Bangalore. Apart from the degree in law and counseling, she also has a book which is called The Safe Journey to Motherhood and many more publications in her name. Thank you so much, Doctor, for giving me your time, and I really appreciate it. We're really excited to know much more about periods and whatever you have to enlighten us with regarding the same.
It's
So,
a
how have you
pleasure.
been,
I'm
Doctor?
equally excited. I'm equally excited to join you.
Thank you so much. So, Doctor, the whole and sole reason of this session is so that we can give our audience a little more understanding on what exactly periods is and the stigmas and the notions which are associated to the same, and how we as a society can have like a better development. In terms of knowledge passing, in terms of being a little more or less resistant towards things like or have a stigma towards periods. So, let's start with introducing, giving a brief, a line or two on what exactly is periods.
Mhm. So basically, periods is shedding of the inner lining of the uterus. So in
Okay,
any reproductive age woman, so basically it's getting you ready to bear a child.
all
So
right,
young girls will start having periods till the time they hit their menopause, maybe around
all right,
49, 50. Every month, the body will keep on waiting for the pregnancy. And once the pregnancy doesn't come in, the lining is shed out so that another new lining will take place next month. So it's a
all right.
nature's way to prepare the bed for the baby month after month. And if the pregnancy is not there, that bed is sort of shed out. So that is a physiological change of having periods every month.
Got it, got it. Interesting. So it has nothing to do with so-called impurities. It's nothing to do with so-called the dirt of the body getting cleansed, etc., etc. Of all the kind of myths that we have had around us, what we've been listening to for
So
years
it's a
after years.
yeah, it's a very purely physiological process, and how we breathe and we eat and we kind of uh, uh, pass motions or urine or etc. Similarly, for
Right.
women, it happens every month, and it's actually a part of a good health. That if woman is menstruating regularly and having periods, it's a sign that her whole system is working nicely. So it's
It's
actually
actually
nothing
great.
to be ashamed of, or nothing to be like that scared of. So it is like, if you're having proper periods timely every month, you should be happy that yeah, you're in good health.
That's great. Actually, I love the reference that you played out as like food, and you have food, you have urination, you have all these processes which are happening in your body, and similarly, you have like menstruation, right? So I really love that whole reference. So yeah, moving forward, education wise, periods are not something which are taught in school. It's
Mhm.
something we get to know from maybe our friends, or maybe an elder sibling, or let's say from now internet and various other modes of but not from where we're supposed to know. One is an education system, two is from our parents. So one, I would like to know that what do you think is the reason that parents are not able to pass this on to their kids, or they're not able to talk openly about it? And
So for
also,
so many, yeah.
yeah, please go ahead.
So many years it was considered like a something women's problem type of thing, that something to be ashamed of, that you cannot
Right.
talk about it openly, etc. So I think from this generation things are now changing. So like, we didn't have this dialogue with our parents, but I had this
Correct.
dialogue with my children. So it kind
Oh,
of and similarly other mothers also come and talk about it, that how to go about it. And another
right.
positive thing has started is that the schools has also started having a sexual orientation class, that that how to kind of deal with the pubertic changes, even for boys, even for girls. So, and they are
Oh,
starting
lovely.
quite early. So that is also actually making the people or the children, mothers, fathers, and students themselves prepared for this change. And since it
Got
is
it.
done in the classroom by the teacher, and you have your friends and all kind of attending the session similarly and together, then
Mm-hmm.
all that hesitation etc comes down.
Correct. I agree. I agree.
uh,
So, like we
if,
mentioned,
Hmm.
that it's in part of the education system. What do you think is the right age to actually teach your kids? When I say kids, I mean both boys and girls. What is the right age to actually tell them about it? And yeah, what is the right age?
So actually, in previous generations, it used to come around 13, 14 years. But now
Correct.
the trend has come down. So from 9 years onwards, we do see young girls getting periods quite regularly. By 10 and a half, almost 80% would have started getting periods. 11th, almost everybody. So very few people are actually going to 12, 13 nowadays. So the best time would be maybe 8 to 8.5 years before they start. Because once they start,
Okay.
they've already gone through
Right.
that trauma and uncertainness, and I don't know what's happening. So before
Yeah.
that only, maybe when your daughter is 8 years old, you can start kind of prepping her up. Ki, okay, this is the time that you should understand all this.
All right. So you suggest 8. And what about the boys? Like you suggest the same timelines or
Boys also should be made aware around that time, because their colleagues or their friends in the school can have these periods, accidents and all.
yeah,
And then if
yeah.
they are absolutely unaware, their reaction would be slightly different. So
Yeah.
let
And
all the people be aware together. So 8 and a half, it sounds little young, but that is how the practical thing is, that people are getting periods at 9. It is like very, very common.
correct, correct. So, doctor, what do you think is the reason that, that we're having such the cycles or are coming like way before the for our parents and probably for our grandparents, it was even later, right? Like
Hmm.
our grandmoms had it much later and our moms had it a little earlier than them, and we had it like let's say in eighth, and now the kids are having in fourth and third grades.
Hmm.
So, what
So
do you think
basically,
is
the
the reason?
exposure to like all
Okay,
this media, etc. Okay, more exposure to mobiles, plus less
okay,
active lifestyle. Like they're more sedentary. They're more in their games, etc. Playing
right.
video games rather than playing on the ground. So all these factors are leading to the periods coming little early. So puberty is basically hitting early, because the awareness of the child is like quite high, exposed to TV from maybe 4 or 5 months only. They will see the
True,
TV,
true.
they'll eat the food
Yeah.
like that. So that is making a lot of difference.
Okay, all right. Wow, that's very interesting actually, because we don't realize how technology has us a boon and bane both at the same time, and how it affects like our body in whole, right? So that's quite interesting.
Mhm.
I have like few quick questions, and we've covered like the major aspect of it, and you've also spoken about how parents are supposed to talk to their kids and when they're supposed to talk to them. Is there like a certain way or form that you suggest, because kids are like 8 years, right? And I think parents right now are who are already parents of like let's say 8 years old don't really know how to transfer that information. So if that's the case, can you tell like a simple and easy way in which they can explain their child what exactly this is?
So basically, you can inform the uh, your daughter that, okay, since women can bear children, okay, so our body is made in that manner, and as we grow older, the body changes will happen, so that you can become little older and a young woman later, and then if once you want to have your own child, you will be able to have your child. But the nature prepares us from little early. So the change that will happen is that your body will start becoming slightly different from how your younger body was. So there would be some changes, some curves and all will start coming, some breast growth
Uh-huh.
will happen. And then your basically the something called bleeding, from where you pass your urine from that area, the bleeding can come out, which will be like happening every month.
Okay.
So then you can again explain that you have a organ called uterus where the baby stays, and to protect, to kind of make your uterus ready, the nature will start shedding the lining every month, so that it is ready, like how you kind of clean your house and things are all kept nicely. Similar way, the this organ will kind of continue to clean itself to prepare for the next baby every month, like
Exactly.
that. And when you grow older and when you marry, you have a husband, you can have a child when you want to plan, but you will have to be ready for it from now on only. So only thing is that you don't have to be ashamed of it, you don't have to be
Yeah.
scared of it, you can talk to your friends about it. Majority of them will be in the similar boat as yours, and you can discuss. Then only thing mama needs to know is that if you are bleeding heavily, if the bleeding is not stopping like for a very many days, like 7, 10, 12 days, you are bleeding continuously, if there's very severe pain abdomen. So all this needs to be, that information needs to be passed to on to, somebody elder. You don't have to
Right.
keep on suffering with it. And so once you tell them, like, in a casual tone, that nothing ha type thing, then they also take it in that sense only, and they get better prepared.
Right,
So it
right.
can
I
be very
think that's
simple, factual type of information you can give. And some people are really hesitant, so they get the daughters to us also, to the
okay.
gynecologist, and
Okay.
we explain them. And coming from the doctor, it becomes even more proper. We have these diagrams and all to explain. So then girls are able to kind of, adjust or have questions, cope up. So they do also ask us questions back.
Oh,
So
nice.
all that,
That's actually,
it's
yeah.
easier for them.
Yeah, yeah, that's actually very nice. So for parents, all those who can explain to their kids, it's great. Like you can do your job, you can do it diagrammatically, or you can do it one-on-one, face-to-face. You can do it however you want. And for those parents who are a little hesitant, who don't know how to really go about it, can also take their kids to the to a gynecologist, the close by gynecologist, and they can get it explained in a very, very scientific manner to them. That's actually a great, great feedback to give to parents these days. So what do you think are the impact of contraceptives on periods?
Actually, contraceptives, it's not only for contraception, it has a lot of benefits also. So
Oh,
contraceptive pills are given to women who have irregular periods, who have very less or high bleeding, who kind of bleed for very long periods of time, who have severe pain abdomen or pain during periods. So it kind of has advantages of taking care of all these problems. So
okay,
contraceptives will make your periods absolutely regular like clockwork. And if you had period pain, that pain will totally disappear. Plus, the amount of bleeding will come down quite a bit. So you don't have to really struggle to keep on changing pads and all that. Okay, so you kind of save
okay,
iron and your hemoglobin improves. And plus, it
right,
gives contraception. So it is not only used for contraceptive purposes, it is used in all age groups for various purposes. So
okay,
periods will be regular with less bleeding and painless with the contraceptive pills basically.
right, right. Okay, I mean that's very informational actually. This is something which is very new to me as well. I didn't know about all these extra benefits that contraceptive pills have. Further on, just one more question because we're talking about contraceptives and periods. I also, and this topic I want to cater to all my Gen Z friends and my cousins. What about sex during periods? Like, is it advisable, not advisable? Should they be careful even while they're doing it then, or what is the deal?
So there's no mandate that it cannot be done medically. It's nothing is mentioned like this, but it's
Hmm.
basically hygiene thing. Okay, if you're comfortable doing it while the bleeding is going on, you can might as well go ahead. Generally, doesn't cause any infection and all. But
Okay,
some people find it messy, and it's like women might be in pain. She might have discomfort. Plus, first second day, generally the uterine part is tender. So
hmm,
having relations that time might be painful for the lady. So it's individual again, your call. If
okay,
you want to have it, you can. If you find it comfortable, hygienic enough, you go ahead. Otherwise, you can avoid.
right, right, right. Great. And also, this one last question. A lot of women these days are very scared of going to gynacs, or even talking about, them missing their periods. So, what is your 2 cents or your 2 words to them? Like, how open should they be about their it could be a physical relationship, it could be like an let's say yeast allergy they've got or missing their periods. How open and honest are they? Can they be with a gynac or should they be with a gynac? Because I know a lot of my cousins hide things when they're going because they're
Hmm.
not comfortable sharing it or they don't know if the information can spread. So I want you to tell them that how important it is.
So it's actually very important. You have to be really honest, like as if you're in a confession room, and you have to say everything which is there. So we generally have heard everything, seen everything, all sorts of cases. So generally, as time passes, nobody's really judgmental. If you think that, oh, she'll judge me, and like it's
Right.
like, okay, we are here to help you. So if
Yeah.
even if you are, see, the times have changed. Now we know that majority of young people will be in a relationship and all that. Okay, having sexual relationships, etc. So it's like, what best advice we can give you according to your circumstances, that will be given. So there's no point hiding anything, because you could be having PCOS, which you didn't realize that periods are coming once in 3 months and all. So there's no point hiding from the doctor. You can hide from your friends, whatever you want. But once you come to the chamber, you should come clean, okay, including all
Right.
the eye pills that you have taken, whatever, other things, naughty things you could have done. So everything can come out, and we can advise you according to that circumstance, that which will help you best. So you have to be
Okay.
as honest as possible, because that will help your cause. I mean, if you give me half information, I will give you half treatment, because I never got the
Yeah.
full information.
Yeah.
So
And I mean, like it's a lose-lose situation, right? Like for them, it's going to take them nowhere. So all you Gen
right,
Z people, like you tell everything to your gynac.
right.
And
Thank you.
and also with swimming, this is one question which a friend of mine had. So when you go for swimming, a lot of people think that you cannot swim if you have periods. I want to know how to go about that. Like, if you can tell me, like, this is the product you need to use. This is what you need to do before you enter the pool. This is what you need to do after. It'll just give a lot of clarity to the audience.
So basically, you can use either tampons or menstrual cup, both. They should be fine. There should not be any leakage, etc. Okay, you can insert a clean menstrual cup before going into the pool, and after, once you come back, you can still kind of take it out, wash it, and again reinsert, so that little bit of some entrance of chlorine water will be able to come out. Otherwise, with these two, there should not be any accidents. Nowadays, these swimwears have come where they will kind of not let anything come out, but it still can be slightly messy. So better to use either tampon or menstrual cup, and you can go into the pool. No worries there.
Okay. All right. I think I'm pretty much covered all my questions, and it was really informative, some for the audience and mostly for me as well. And I'm really enlightened with this whole period and how to handle it better. And I really, really thank you for your time, Doctor. It's really an honor to have the last half an hour with you, and I can't thank you enough.
Thank you so much. It
Thank you
was a
so much,
pleasure.
Doctor. Hope you have a lovely, lovely day, and take care.
Bye.
Bye bye.
Bye.